Lots of people ask me what is a traumatic event for a child. Something we want to keep in mind is that it matters how the child experiences the event. We call this the subjective experience. So a traumatic event happens when a child is threatened physically or they see someone else be threatened physically, and it overwhelms their ability to cope with the situation. So because of this, 1 in 4 kids actually experience a traumatic event by the time that they're 16 years old. And it's really normal to have some symptoms or reactions after a traumatic event. Some of the things we'll see are regressing to earlier behaviors, which means things like maybe sucking your thumb if you had outgrown that, or being more clingy with mom and dad, or having tummy aches, or not wanting to go to school. Older kids and adolescents might start stealing or might be acting out aggressively or staying out kind of late. So all these things in the initial aftermath of a traumatic event are totally normal. What we want to be more concerned about is when there's something called functional impairment going on. So because it's normal to have symptoms and reactions after a trauma, we look at the duration and the intensity and the impact on daily living. So how long are the symptoms lasting and how intense are they? Are they interfering with kids' ability to do their jobs as kids, which are to go to school and do the best they can and to make and keep their friends? And so if that's happening, their functioning has been impaired, we can connect them to treatments. And the good news is that there are very good, very effective treatments for children who've been exposed to trauma.